For any parent, learning that their newborn has a heart defect would be a major shock. But there's a team of experts providing the best possible care right in our own backyard. Here with more on his team's approach to helping babies with heart conditions is Dr. Damian Lepar, pediatric and congenital heart surgeon at UT Health Houston and Children's Memorial Hermann. Welcome, Dr. Lepar.
Yeah, thank you, Derek. Thanks for having me today.
So we were just chatting during the break. February is National Heart Awareness Month, and heart defects are actually the most common birth defect. Is that true?
Yes, it's true. It's actually a little known fact for many families out there, and especially new parents, that congenital heart defects really represent the most common form of all birth defects and occur in about 1% of the population. So that's about 1 in 100 of every child in a given classroom setting most likely has some form of a congenital heart defect that may require, treatment, whether that's medical or surgical. As you can imagine, there's an entire range of congenital heart defects out there, varying from very benign and maybe clinically insignificant to extremely complex congenital heart disease that requires a lot of medical therapy as well as surgery oftentimes throughout a patient's lifetime.
And Dr. Lepar, I'm guessing that a lot of our viewers might be surprised to know just how common heart defects can be in young babies. The good news, though, is many of them can be treated, and a child can go on to live a very long, healthy life.
Yeah, I think that's one of the most surprising aspects and most encouraging aspects of our field is that really over the past several decades, we as a field have been able to really innovate and advance a lot of different medical and surgical therapies to where we've taken heart conditions that in the past may have been completely untreatable to ones now that we do almost routinely on a day-to-day basis and treat these children and their families and give them normal lives and excellent qualities of life afterward.
Are there any tests, doctor, that you would recommend for parents expecting a child? Is there anything that they can do to ensure that their child's heart is totally normal?
Yeah, absolutely. I mean, I think the most important thing with new families that are newly pregnant is to follow up with their routine, obstetrician and maternal fetal medicine visits, get as good a prenatal care as they can. And usually most congenital heart defects, the very large majority, are actually picked up in the prenatal period before babies are born through this routine screening and treatment and diagnosing that goes on. In the setting of a fetal heart center such as ours here at Children's Memorial Hermann Hospital, when a congenital heart defect is diagnosed, they're automatically captured into a supportive environment and a system that's there to help support their needs and help counsel and educate them as to what the best treatment and strategies are going to be available to them and their child when that baby arrives.
And the Children's Heart Institute, I mean, as you mentioned, helping the family through this process, I can imagine, as you said, just counseling them through how to handle this situation is a critical part of what you do.
Yeah, look, I mean, I can't imagine, I'm a father myself, and I can't imagine how much of a shock and how much confusion goes into receiving news that your new baby or your baby that's coming in a few weeks or months has a congenital heart defect. And this is often a completely unanticipated experience and a new reality that parents are confronting. And so it's important in those moments that we as healthcare providers provide a true comprehensive approach to counseling them, educating them, but most importantly, helping them to understand that there is hope. Oftentimes families that come to see us are told that there is no hope for their child or their congenital heart defect. And it's important for us to be able to quickly assess whatever that baby's needs are going to be so that we can act quickly to help that patient and their family achieve whatever it is that they need to in order to get treatment.
It seems like living in Houston, Dr. Lepar, is just a huge benefit because we have access to so many incredible specialists here. And now with advances in technology, you're able to see the quality of life dramatically improve for conditions that maybe even a decade ago wouldn't have had the same positive outcome.
Yeah, that's absolutely accurate. We are very fortunate here in Houston to have such an innovative and robust healthcare environment here at the Texas Medical Center, as well as with all our other healthcare facilities in and around the region. It's really something that allows us as heart surgeons and as caretakers and physicians and nurses and providers here to really help these families realize that there is a quality of life even with a complex congenital heart defect that they may be diagnosed with. At our heart center, we tend to see and we operate on the most complex of all congenital heart disease, and we're able to achieve the greatest clinical outcomes through our approaches to innovation and leadership, research, and most importantly, patient-centered and family-centered care that exists here in our environment and in Houston at large.
Well, and as you mentioned, you're a father yourself, so I understand you know exactly just how important and meaningful this work is. Dr. Damian Lepar, thanks so much for your time.
Yeah, thank you so much, and happy President's Day.
Thank you so much to you as well. And to our viewers, if you would like more information, you can visit memorialhermann.org/children's-heart-month or call 713-486-6755.